Dr. Bamberger, how would you describe the connection between health and home?
So as a physician, we carry a lot of tools in our black bags, and we can get a lot of prescriptions filled at pharmacies. But in my career, I've never had anything that can impact a homeless person's life and to improve their health as much as a safe home. And it really is remarkable for people who have lived all of their adult lives experiencing trauma and substance use. When they can move indoors and have a beautiful place that's safe to live in, their health improves in every area. Their blood pressure improves, their mortality as a population gets less, and most importantly, they are able to form the kind of relationships that we really feel are the cornerstone of life.
If you could write only one prescription for homeless patients, what would it be?
So when you think of a prescription, you think of a medication, you want to have something that is going to have low side effects and high efficacy. And what's remarkable about beautiful housing, housing that's safe, that doesn't take away from other things such as the ability to buy food or to buy medications. When you think of that medication, it has this really narrow therapeutic window, broad therapeutic window, in that people just are able to benefit from it without any harm. And that's very rare in medicine. And it's a tremendous thing to be able to have that prescription available or that treatment available in my black bag.
What would you most like the American people to appreciate about the broader impact of home and health?
I think the biggest thing that I would like American people to recognize is how wedded they are to healthcare expenditures. Where here in San Francisco, we'll have people who lie down on the Golden Gate Bridge to have access to antiretroviral treatment. And yet the benefit of antiretroviral treatment for homeless people with AIDS is minimal without housing. And yet we don't have the American people lying down on the Golden Gate Bridge demanding that everyone deserves a stable place to live. And if we were able to pivot our focus from medications to housing, not only would we have a healthier society, but we'd have less cost. And one thing that will truly change both the expenditure of the country and the quality of our society is providing permanent supportive housing for the most needy in our society, the people who are living with substance use, mental illness, and chronic medical conditions. If we can do that, we can both improve quality of life and reduce cost.